Hey guys, welcome back to my channel. As you can tell by the title of this video, we are doing part 2 to our Q&A. I asked you guys if you guys had any questions for me on my Instagram, and you guys gave me so many questions. I might even have to do part 3. Not sure. Trying to do as many questions as I can in one video, but I also don't want to bombard you with questions. But yeah, so that's what we're going to be doing. If you guys have not seen part 1, I'll make sure to link it right up here for you. But yeah, let's get into it because we have a lot to talk about. You guys have a lot of questions, a lot of good questions. So yeah, let's get into it. Make sure you guys subscribe if you haven't already. Make sure you like this video. And yeah, let's get started. Okay. Is there a lot of chemistry in nursing? I struggle so bad. So no, I would not say there's a lot of chemistry in nursing at all. The most that you get is like dosage calculation, which is more math. It's more calculating, like the doctor gives you this prescription and this is what the recommended should be, or what the actual prescription bottle has, and like you have to do simple math. But that'll be more like algebra kind of rather than chemistry. And no, we don't use chemistry very often, if at all, in nursing, so no. How do you keep going when it feels like the classes and clinicals are endless? So I keep going because of my family. I mean, my support system is amazing. Thank God. I have a family that really supports me. I have a boyfriend that supports me, and I have great friends at school. So that kind of helps push me. And whenever I don't feel motivated, I feel like I look to my friends and like they motivate me a lot because they're such hard workers and they're awesome at school and they push no matter what. I don't know how they do it, but I do get unmotivated sometimes. I also have my vision board that you can see behind me, and that also kind of keeps me accountable because I can see my goals every single morning, every single day. Whenever I don't feel motivated, I also like to watch YouTube videos on, you know, how to get motivation and stuff like that. Another thing that kind of keeps me motivated is being in clinicals and seeing what my end result will be, which is being a nurse, obviously, and helping people. So that kind of is what keeps me motivated. How do you manage to still have a life? How do you deal with the difficulty of it? I feel like you still kind of have to find a balance. So it's really hard to like keep up your life, especially if you have a boyfriend and you have friends in addition to nursing school. You kind of have to have people that really understand. Like when I spend time with my boyfriend and I'm studying for an exam, we're sitting next to each other, but we're not really talking. I have my headphones in and I'm studying. So I have like the noise canceling headphones. So that's kind of how we hang out, because I have so much to study, and thank God he understands, so he doesn't like get upset if I can't spend time with him. But usually when we hang out is like right after my exams, just right before I start studying for the next exam. I'll take like a day to myself and I'll kind of go to the movies. We'll hang out with him, I'll hang out with my family and stuff like that. But you also do have to kind of step away from school sometimes and still enjoy time with your family, especially if you have kids. I know there's a lot of moms that watch me, and I know of course that's always going to be priority, and a lot of classmates that I have are actually moms, and they also struggle to kind of find a balance between, you know, doing really good in nursing school and finding balance between family. But you kind of have to find your sweet spot. You can't concentrate 100% on nursing, and of course you can't also concentrate 100% on your family, because if you do, you will fail. Like, that's the truth of it all. I feel like right now where I'm at is like 70% nursing school, 30% hanging out with family, friends and stuff like that. And I have to like kind of find my balance. So like what I'll do is if I'm studying like really well, and I wouldn't mind taking an afternoon off or taking an evening off, I'll kind of have like a night designated for what I'm gonna do. Like if I say, hey, I'm gonna go to the movies on Saturday, I'll make sure to study a bunch before, so I don't feel guilty for taking away that time, and I don't feel super stressed out when I go back to studying. So that's kind of how I manage it. But truthfully, it is really hard, and you know, sometimes I'm just need to step away from school, or I need to step away from my family, and I need to go to the library and study, because I mean, we got to do both, you know what I mean? And it's kind of hard to handle both, but of course you still have to give time to your family as well. So can I start nursing school directly after high school, or does it depend on the school? No, you cannot start nursing right after high school. You have to do prereqs. So a lot of the prerequisite classes, if you're doing your BSN and your ADN, it's going to differentiate. For your ADN, there's not as many classes that are required. I believe the only classes that are required for an ADN is an associate's is anatomy and physiology 1 and 2 and microbiology, maybe nutrition, I'm not sure. And then for BSN, you have a bunch more. Oh, and in addition to the ADN stuff, you also need to have like your real basics, like your English, your history, your government and stuff like that in order to finish getting your associate's degree. And then for your bachelor's, you also have a bunch of other credits. It's about 2 years of prerequisites you need to have before going into nursing school. Either way, if you did not have anatomy and physiology and microbiology as a background before you start nursing school, you are going to drown so miserably. So no, you cannot go directly into nursing school. You have to have those prerequisite classes in order to get in. And that's also how your school decides if you are worthy enough of getting into their program and if you are ready and prepared enough to get into their program. So yeah, you need to take those prereq classes before you're able to apply and get into a nursing program. Let's see, would I be seen as unprofessional in nursing if I were to get a nose piercing? As you guys can tell, I do have a nose piercing, but when I do have clinicals, this nose piercing is not in my nose. I take out my nose piercing before every clinical, and as a nurse, I also am not, even if my hospital allows me to have my nose piercing, I am not going to choose to have it just because I don't think it is very professional, even though I have it myself and I've had it for 4 years. This is something that I enjoy, but just like wearing hoop earrings, I love wearing hoop earrings. Am I gonna wear them to work? No. It's just something that you kind of have to find your balance between what is professional and what's not. So to me, I don't wear my nose piercing. Besides, my school does not allow me to have a nose piercing, just like you're not allowed to have abnormal colors in your hair just because we have to keep a professional image, and we have our school's logo on our shirts, on our scrubs. So of course we cannot have nose piercings. So super nervous for my first day of clinicals next week. Should I be feeling like this? Yes, I feel like it's good to be nervous just because I mean, what we're getting into is really exciting. It's really crazy. It's something so different than what you're used to doing. I mean, you have people's lives in your hands. You know what I mean? If you were too comfortable, I feel like that's not good because you're not taking it as serious. So you being nervous is kind of a good sign that like you take this very seriously and you're willing to make yourself nervous to push forward. So as long as that nervousness doesn't stop you from pushing forward and from learning and from like starting IVs or doing stuff that makes you uncomfortable, as long as it doesn't stop you from doing that, that nervousness is good. Just because, I mean, it pushes you to work harder. You don't want to feel nervous, so what are you gonna do? You're gonna work harder to make yourself not feel nervous anymore. So yeah, I think that it's good to be nervous. Like I said, as long as you're able to still do what you have to do and that nervousness isn't stopping you from progressing. So. Do you think you want to further your nursing career to be an NP or a CRNA? Yes, so my plan is to be a nurse practitioner. That is the end goal. I want to work at a doctor's office as a nurse practitioner. My plan right now is I graduate in December 2019, and then I'm going to go on and do my bachelor's online. Hopefully I will have a job lined up by then, and then after I finish my bachelor's, I would have already had probably like 7 or 8 months of experience, so I might take off a good 5 more months after that, so I have a year of experience minimum, and then I will apply to get into a master's program to get my nurse practitioner. I don't know exactly what field of nurse practitioner school I'm going to go into. Don't know if I'm going to do like a labor and delivery nurse practitioner or what exactly I want to do. I always thought I was going to be a pediatric nurse practitioner, but kind of right now it's just all up in the air, so I guess I'll figure it out once I am a bedside nurse. But yes, the end goal is to be a nurse practitioner for me. I'm struggling through prereqs already, AMP, micro, etc. Is nursing school even harder? Yes. I've explained this in my last Q&A. The difference between your prereqs and nursing school is definitely going to be, your prereqs is going to be more memorizing. Nursing school is going to be more memorizing and applying it. In nursing school, you have to, of course, know the knowledge. You have to know the material, but on top of knowing it, you have to be able to pull apart that knowledge and make it fit into whatever case study you have or whatever thing you're trying to fit, whatever question you're trying to answer. You have to be able to pull that information apart and be able to apply it. So a lot of the times, like, they're gonna ask you, let's say for example, a patient comes in exhibiting signs and symptoms of this and her labs show this. You have to be able to first know what are we thinking that this patient has? What are the signs and symptoms showing us? And then because of the signs and symptoms, what interventions do we have to do? What complications can occur from that? And what's gonna be, let's say, the nursing priority? Stuff like that. So you have to really like think through these questions. It's not just gonna be like an answer that kind of stands out at you just because you've studied. It's something that really requires you to critically think in order to answer the question. So that's kind of how the difference is. So yes, it is harder. If you're struggling with prereqs, you might want to watch YouTube videos. What I used to love for anatomy and physiology was Crash Course on YouTube. I learned a lot by like videos and stuff like that. I also have a whiteboard that, especially in anatomy, I would draw out every single system. I would draw out all my bones, I draw out all my nerves, I draw out all my muscles, and I would do it over and over and over and over and over again. I would also print out like the body system empty, and I would literally just draw everything on it until I can memorize it. So that's how I did anatomy and physiology. How do you handle depression, anxiety moments if I experience them? So I don't have depression, and I don't have clinically diagnosed anxiety, but from what I have learned about anxiety from nursing school, I do feel as though I do have anxiety, which I don't take very lightly. I did not have this problem before I started nursing school. It's kind of something that's come along with all the stress and that nursing school brings. And what I do is I feel like the gym really helps me to relieve some of that anxiety and tension that I have. Another thing is I love essential oils, and I know I've talked about this before on my channel, but it's something that helps me. I love to use like lavender and like stress relieving essential oils, so I'll put that in my room. I'll put it in my room, especially before clinicals. I'm like really stressed out trying to go to bed, knowing that I have to wake up at 4 in the morning, and knowing that I might have to do a head to toe or an assessment the day of clinical. That makes me like super nervous, so that's something that I do. What else do I do for anxiety? Oh, another thing that I do for anxiety is I like to look up quotes. There's actually some really good quotes online, like on Pinterest and stuff. So if you look up like student anxiety, like quotes and stuff like that, that's something that also helps me. Another thing that I used to do a lot, which I haven't done as much and actually need to pick up again, is journaling and writing down all my worries and writing down positive things related to my worries and like positive affirmations related to my life and related to, you know, what I think I'm capable of doing. Also, if you suffer a lot from anxiety and people around you in school have anxiety, I would definitely say maybe take a step back. Don't hang out with people that make you have anxiety or that stress you out, because you really don't need any additional anxiety on top of what you already have. So definitely taking a step back, breathing, running, walking, all of those things is what helps me. After getting this far in your nursing journey, have you had any regrets? I have not had any regrets in my nursing journey. My nursing journey has not been easy, just like I'm sure not a lot of you guys' nursing journey has been easy. I feel like nursing is something that nobody really understands how difficult it is until you're actually in college and looking to apply to nursing schools, and you really notice how hard it actually is. You know, I had changed my degree. If you guys have not watched my Get to Know Me, I'll put it right here, but I had changed my degree. I originally thought that I was going to be a lawyer, so I went to a university for a year that was not nursing, and that whole year I had no idea what I wanted to do. Second year of college, I decided I'm going to go into nursing, change schools, and my first year of college, I did okay. I got like B's. I think I had a couple C's and then A's, but it wasn't like me working insanely hard. I was just, you know, fresh out of high school. You know, you think that in college you don't need to make good grades. I mean, not that you didn't need to make good grades. I was just like getting by, you know what I mean? And I had no idea how hard nursing was until I was deciding to apply, and I went to go see an advisor, and they were like, oh, well, since you didn't take all your prereqs here, it's gonna be really hard for you to get into our nursing program, and this and that, whatever, and it really discouraged me, and I was like, no, there's no way, there's no way. So I started doing research online, and yeah, it was pretty hard for me to get into nursing, but I don't have any regrets. I don't think that I would change anything. I feel like where I am right now is where I was meant to be. I feel like God just has a plan, and I am living his plan right now, and everything happens how it's supposed to be. You know, if I would have gotten in earlier, maybe I wouldn't have enjoyed my school. If I would have gotten in, you know, anything would have changed. I wouldn't have been the person that I am today. So no, I have no regrets in my nursing journey. Okay, the next question is, what is the hardest part about clinicals? I think the hardest part about clinicals is probably hoping that you get a good nurse. A lot of the times when you go into the hospital, like, nurses don't want to have nursing students, which I don't know why. We're very helpful. Like, all we want to do is help the nurse and like learn as much as we possibly can. Like, we're not there to be a bother. We're there to help and make their day easier. And a lot of the times that I do have nurses that either, like, you can kind of tell like they don't want to have a student. By the end of the day, they're very thankful for everything that I helped them with, and they're very happy with what I did for them. Like, I'm there to kind of do the easier stuff, you know, and I just want to learn. So I feel like a lot of the time when you don't have a good nurse, you're not able to really get a good experience in the hospital, and you don't get to practice like starting IVs. You don't get to practice, you know, connecting the tubing, giving IV medications in general, teaching, stuff like that. And you don't feel comfortable to even do that. So you don't even want to ask a nurse that doesn't really want to help you or doesn't really want to have a student, it's really hard to get a good clinical date out of that. Another hard thing about clinicals is definitely the checkoffs. I don't think that it's necessarily hard. I just think it's really stressful. Like, it stresses me out so bad, but I feel like I do learn a lot from doing checkoffs and stuff like that. But another annoying thing that's not necessarily hard about clinicals is definitely filling out care plans and concept maps, just because it takes so much time. And thank God right now I've found like a good couple apps that help me while I am filling out my concept maps and my care plans. I might make a video actually about apps that have helped me in general in nursing school. I feel like that'd be a pretty cool video, but I do have some good apps that have been helping me while I am in clinical. So let me know if you guys want to see that. What was my first time in clinicals like? So my first time in clinicals, I did a lot of patient care tech work. So I did a lot of cleaning, a lot of changing linens, a lot of helping people go to the restroom, stuff like that, just to help me get more comfortable in the hospital setting and being around patients and stuff like that. So it was a lot of safety stuff until we got to learn all our skills. And then once we got all our skills, we were able to practice that. So we had to get checked off in school first, like in our skills lab, and then we were able to practice those skills in clinical on real people. But that was my first time in clinicals. Was more like safety stuff. So like learning how to raise the bed and like learning how to, you know, turn patients, learning how to clean patients, learning how to change linens, like all that stuff is like the first time, like what you do in clinicals for the first time, talking to patients, doing a lot of teaching, and trying to learn like all of the systems and all of the things that are around them and stuff like that. And then getting used to like the computer systems and stuff like that. Like it's very basic, I think, the first semester of nursing school. But I did also get to give meds and like get to give injections and stuff my first semester. But yeah, that's what it was like. How do you prepare the night before your first clinical? I feel like the night before my first clinical ever, I watched a lot of like skills videos, and I watched a lot of like safety videos, like how to move patients, how to help patients to the bathroom and stuff like that. My school actually has like skills videos on our Blackboard. I don't know if everybody uses Blackboard, but it's on our school website. So I watched all of those videos like over and over and over just to make sure that I had enough and like I felt comfortable helping patients, you know what I mean? Because there's definitely, you think that you know like how to help somebody up, but like it's not always the safest way. So that's a lot of what I did before my first clinical. Also looking at like all the paperwork and stuff that we had to do and kind of familiarizing myself with that really helped too. But that's kind of how I always prepare myself before clinical, is watching a lot of skills videos. Have I worked with any respiratory therapists? If so, how is it? I have worked with a lot of RTs. RTs are great, just like PTs. I love working with them. I feel like they're always really sweet and they always really appreciate having help, just because they don't have patient care techs like nurses do. But yeah, I mean, I think it's interesting learning about RT and PT and stuff like that and helping them wherever I can. But yeah, their field is definitely a lot different than nursing. Like we don't really learn a lot about RT and PT. We learn very basic, so I definitely respect everything that they do. But yeah, my experiences have always been really good with PTs and RTs. How has your experience been with doctors? Everyone says that they're mean to us. So my experiences with doctors have not been terrible. I don't really talk to doctors a lot. Most of the time I like follow them in there just to listen to what they're saying to the patients, but I don't actually get to like face-to-face have a conversation with us. I've not had any experiences with mean doctors. When I was in the OR, the doctor was actually super, super sweet, and he like let me stand. Like he was like making sure that where I was standing was a good field of view for me to see what he was doing, and he got to explain like things to me like while he was doing it. When I Okay guys, so I'm gonna go ahead and conclude today's video. I really hope you guys enjoyed this video. I do have some more questions. I might do a part 3. You guys let me know. If you guys have any other questions, leave them down below. But I do wanna make sure that I answer your guys' main questions. But yeah, I really hope you guys enjoyed this video. If you did, make sure you like it, and I'll see you guys in the next video. Bye.